Now, the key with this legislation was, you can't read this, so I'll read some of it because you're going to just find this hilarious. The one thing we did going into when we started talking about antibiotics is we did not want another proposition that limited how much space chickens could have. So what happened was we killed everything in the legislature over room for chickens and pigs and everything else, and then it went to the ballot, and we had a proposition that was very difficult to comply with because it didn't explain itself. You have to be able to flap your wings and not touch the edge of a cage. So we knew that if we did nothing in California, it could get on the ballot. And so we wanted to make sure that we were proactive and we didn't have to learn a lesson twice. So we wanted to try and be part of the process rather than have something handed to us. So in 2014, there was a couple bills introduced. One of them was introduced that, okay, try and make sure you can understand this bill. This is actual language from the bill right before it died. It prohibited the sale of products in California from livestock or poultry that were given medically important antibiotics for non-routine disease control unless certain conditions were met. Okay, and then it also required all products sold to be from a slaughter plant, which I like to say harvest facility, that reports the use of antibiotics during the lifetime of the animals were harvested. You have to have the type, the dosage, the purpose, the disease that was treated. So the harvest plant would have to keep all of that if any of their products in the slaughter plant went to California to be consumed. And then it also required my department to keep a use data in a searchable, consumer-friendly public website that allows for comparisons of use of all this information. Actually, laws like that are pretty easy to kill, honestly, when they get that far off to track. But that's kind of what certain people were pushing for. It did exempt small producers, less than 250 animals, or 10,000 birds, which I thought birds were animals, but both birds and animals have been exempted for some reason. In that same year, another senator who's pretty much more reasonable, Hill, introduced legislation that basically was the same as FDA's 215, 214, 213, and that got through the legislature, but the governor vetoed that, and he said, no, I think this antibiotic issue, personally, he really feels that it's a serious issue, and he wanted to see us doing more in California. So his veto message basically was do more. So we entered the next legislative cycle, still with the possible of a proposition on the backs of our minds. And the reason I'm sharing this is because this is happening in a lot of other states right now. And so maybe by sharing just a teeny bit of the detail, you can think to yourselves, well, that works, maybe we'll try that, or we'll never do that. That's not a good idea. So I'm just going to share a little bit of the journey. But we had a working group that we put together, because the governor's veto message also put, thank goodness, thanks to us influencing him, put it on the Department of Food and Agriculture's back to kind of come up with some collaboration for the do more legislation that went in the next legislative cycle. Our legislature meets every year, a lot. And so we worked with the health department. We were really trying to get credibility because a lot of consumer advocates were pushing a certain agenda. And so we wanted to make sure that we had some people that could add some credibility to the voice of farmers and ranchers and veterinarians. So we had people from the health department, including an MD who's in charge of the stewardship program for hospitals. So they have a mandatory stewardship program in California for hospitals. So having them on the working group, lends a lot of credibility. We also had our Veterinary Medical Association, some representation from academia, and also from our Vet Medical Board. And we did a white paper, kind of talked a little bit about antibiotics. We drew heavily from a lot of the stuff that came out of NIAA. And we kind of laid out, some potential actions that could be taken in California. It really mirrored a lot of what's happening at the national level. But what we were trying to do is get grassroots people, and we shared it kind of secretly with all of our animal agriculture organizations so that we all could be on the same page before anything went through the legislative process. And then Senator Hill, the person who's whose bill almost made it, who was actually quite reasonable from near San Francisco, so very urban area, was his where he represented. He had a lot of success in the past. He was also working on human antimicrobial resistance, so it was hard for Animal Ag to say, well, humans aren't doing anything, because that same exact senator had moved forward some improvements in human use. And he was very good at engaging all stakeholders, including consumer advocates and animal agriculture, and giving a little pushback to both when they needed it. So this slide kind of just summarizes a little bit of the journey. And like I said, the bill, they told us to do more, so in the bill, which I'm going to go over in just a second, how it ended up, it does do more than what FDA is doing this year, next year. There's a lot of debate on what is medically important. I'm sure, because you guys are all, this is like preaching to the choir, right? There's a lot of debate on what should be medical important. Some people wanted to use World Health Organization lists and everything else, but in the end, we were able to have the bill refer directly to Guidance for Industry 152. We're really trying to be in the same place as the rest of the country. Then there was, if we implemented it too soon and we had more required veterinary oversight than federal, and there's a conflict with labels, there was some fear with compliance and labeling. But the implementation date for the use parts 1 year past when FDA is going in, except for one thing, which I'll tell you about in a minute. So there's a lot of debate, and this is happening nationally too, over just feed and water, which we all know that's the quantity of antibiotics are all, including injectables. Our bill does, or the bill, it's not really my bill at all, the bill does include injectables. But there's a lot of issues. I mean, there's enough issues with access when you're talking feed and water, right? So if you talk about injectables, you're really talking sheep, beef producers that are more remote. Mostly our dairies, they all have vets. It won't be an issue for them. But some of our other producers, it's going to be a hardship. So there's a lot of talk about access. So there's some language in the bill that talks about still allowing it through retail, just like we talked about with VFD. Our retail stores already have to register with our department if they're selling veterinary drugs, certain restricted drugs. So just if they sell something with a prescription, I think we can still handle it. And our veterinary client relationship just really requires once-a-year visit. It has a lot of other requirements, just like most do. But so practically speaking, though, besides a couple of other things, the vet needs to be there once a year. There was a push there's a lot of resentment that, why does everybody focusing on livestock? We understand it because of the issue of not just resistance, but also it's a food, potential food product. But when you think about it, dogs and cats, they're pretty close to their owners on a regular basis. They live longer. They probably have antibiotics more often, and stronger antibiotics than our livestock do. So there was a lot of discussion about, and frankly, the vets, everybody was kind of on board for including small animals as well in the bill, not just livestock. Consumer advocates really did not like that, so that didn't get in the bill. Right. And the thought was, if you're moving more drugs under a veterinarian, then we should also provide veterinary training. That was in the bill, but there's a companion bill there's CE requirements now for veterinarians in California to maintain their license related to stewardship and judicious use. Companion bill went through at the same time. Tracking use was a huge issue, just like we talked about this morning, the matrix when you track. But the biggest issue in California was confidentiality. So I think producers have the same questions. I mean, they're concerned about resistance in their own animals for their own animal health just as much as anyone else, but they just don't want to be made into the poster child and have data be taken out of context. And especially there's a few big name brand producers in California, and they already get beat up on a daily basis. They just I mean, they wouldn't come out and say this, but I know it. They just didn't really want to fan the flames. So by having some confidentiality, we could get good in-depth data, and they'd be much more willing to come forward with it. It also, well, anyway, and having confidentiality protected in California is like a miracle that got in the law, but it's specifically protected. There's a lot of argument, just like nationally, prophylaxis, preventative use, back and forth. We really used our physician counterparts to help us make the argument themselves, although some of them were the biggest arguers against using it prophylactically in animals, using antibiotics prophylactically in animals. But when we, turned the table and said, well, what if it's you? I mean, put yourself in the veterinarian's shoe. Do you really want the legislator telling you how to practice medicine? And they didn't. So we were able to get them to kind of help us and come around eventually to keep prevention in there, but it's pretty well defined. So you can't, which I'll go over in a minute, so it's sort of middle of the road. Stewardship, there was some early argument that it should be regulated, which is not really stewardship. Again, do we really want the legislature practicing medicine? I don't think we do. So even when I mentioned before that our hospitals must have stewardship programs, that's what the regulation says. They must have stewardship programs. It doesn't say what they have to do to have stewardship programs. So there's a big difference. And not only that, they don't need to mandatorily report use, although that is a part of their programs. And then there is a big push because probably a lot of you in other states are feeling it. There's certain advocacy groups that want specific language in both federal law, but also to try to get it in other states. And so they didn't want California to get language in our law that was different than what they're trying to push federally. But California is not, don't say thank God, is not, Iowa or Ohio or Florida. We're all different. So we really wanted our legislation to reflect the landscape of our animal agriculture. And I think in the end it did. And then this is the biggest thing, and we see this time and time again, and this is what really ticked our producers off, is a lot of times there seemed to be hijacking of the issue. So they hijacked the antimicrobial resistance really to be a tirade against animal ag production. So we fought really hard, and we kept just trying to bring the argument back, and having physicians and other departments helping us do that, bringing back to the issue of resistance, which in all of your NIAA is probably the master at doing that.
Annette, I have a question that how do you deal with the mail order houses that have their inventory out of state and they're moving inventory into the state? How do you deal with that in the licensing sort of process?
Yeah. So you think that we're not going to be able to enforce some of this? Is that what you're saying? Because it's not national? It is going to be very challenging. The one area, and I'm just going to go over just real quickly, a couple pieces of the law and talk about that a little bit more. But we're going to need better regulations to define exactly how you can still get, especially the injectables, because I think that in feed and water that's going to be handled nationally. We'll figure that out together as a nation. But the things that are be different in California, which are the injectables and boluses, that's going to be very tricky, and I don't think that we're expecting perfect implementation. It's a step in that direction. It's going to be very challenging, though. So just the law basically has three things in it. It has limits of use, similar to what I talked about already. That goes into effect in 2018. But then it also puts the responsibility on our department to develop stewardship guidelines and monitoring and surveillance. So just that kind of how I, in my mind, break down the law. So the limits of use, it does not apply to bees, so that kind of helps with that issue that's going on nationally, right? There's the issue with bees and antibiotics and medically important drugs. And it does not apply to pets. I already talked about that. Horses, our pets, horses are livestock. Some states define them one way or another, and our state is pretty vague, so we're going to have to figure that out. Like I said already, it refers specifically to Guidance for Industry 152, Appendix A, for what antibiotics are included, and ordered by a veterinarian or prescription, and it under a veterinary client-patient relationship, very similar to FDA, except for like I've mentioned a couple times already, the injectables and boluses that aren't covered by FDA yet. And so it talks in similar language: treat, control, and in some cases prevent disease or allowed uses. Prevention and prophylaxis. Basically, it specifically says if it's related to surgery or medical procedure. And we thought this was really good when this language got in there. In the professional judgment of a licensed veterinarian is needed for prophylactics, et cetera, et cetera. So basically, it put if you need it to prevent, and the veterinarian thinks you have a specific problem, the veterinarian has the ability to use it as a preventative, and you just would need good records. But at the very, very last minute of the 10th hour, they even broke some procedural rules to do it. There was this other thing added. Well, they actually just changed the order of it, and that changed the meaning. If it's used to prevent a disease beyond when related to surgery or medical procedure, it doesn't specifically say this, but this is what it means. It can't be used in a regular pattern. So the piglets, the example given before, where they come in and 2 weeks before they even get there, you're ordering their preventative use antibiotic in their feed, you would need, and you do that every single time. If that's in California, the veterinarian would have to be very clear in their medical record about, well, maybe they're using it to control disease, actually. So if they're using it every time, is there existing disease that needs to be controlled? Or they need to be very clear on what disease they're trying to prevent.
Excuse me, does it matter what's on the specific label? I mean, if the label for use does not use the word prevention, does that make a difference if it has a control and treatment label? Any discernment on that?
And that's where the problem with when the state starts to do rules and FDA does labels. So what the state is regulating is the producer and the veterinarian. So it's saying you can't use it for, it doesn't really matter what the label is. So if a veterinarian is using it for a disease, they just need to make sure the record, whatever the label says, they need to make sure. Now, off-label, I mean, that's a whole other thing if you're using something off-label in feed, we know that one, but.
Is dry cow treatment prevention or control?
Exactly. Probably, I don't know. But I think, so dry cow treatment's the big issue, because we do have a lot of dairies. And we do dry cow treatments. Although, some dairies are looking at different ways of handling their dry cows now. But if you do have a recurrent problem again and again, I think any vet worth their salt can have good enough records to back up use as preventative or control. So that's the key, though, is make sure the records are there. And the same weight gain, we know that one. So this is kind of where we started talking about retailers. So in California, just like a lot of places, you can get veterinary drugs from a veterinary drug retailer, which are licensed through a different agency that does all the pharmacies and everything else. And then also there's, a long time ago when we went through this antibiotic cycle of interest about, 15 years ago, the compromise was to say any retailer like Tractor Supply or whatever farm store it is that's selling, say, penicillin, PPG, they have to register with our department and then keep records of their sales. So that's kind of where it ended. There was no real restrictions on sales. So this law is allowing us to continue to do that, but they'd have to keep the prescription. But exactly how that works, it's trickier than you think in how those two different laws work together. Because right now, if it has a prescription, they can't register with us. So we got to work that out. But the intent is to let them to continue to distribute, but they just have to have a prescription and keep it on file. So that's more record keeping. In violations, so the veterinarians are basically, any violations will be handled as they handled are right now under our Practice Act. So it would be a veterinary medical board that would be dealing with veterinarians that are in violation. And then anybody else are our department deals with those violations, and it's a $250 a day, up to $250 a day, or $500 a day, and we haven't come close to figuring out how the violations would work. We're way far away from violations at this point. Okay, the second piece is stewardship. That's where we're supposed to be working on that immediately. And what I didn't want, and a lot of consumer advocates tell me that if we just use less antibiotics, we're going to be better stewards, period. We just need less antibiotics because we'll have less resistance, period. And we kept making the argument, and they kind of listened, that it's not that simple, again, preaching to the choir in this room. And that when we talk about stewardship, what we really need to do is be able to gather enough data, work with a lot of the stuff that's happening nationally right now and within our state, and come up with best practices that are both, because we looked at hospital models, hospital steward, just like you guys have done here in different forums. So some decision trees, things like that, and best practices for vaccination. But you can't really, a lot of that exists, but a lot of it doesn't exist because, as I've tried to explain to other audiences, again, as many of you have, you think stewardship's hard to implement in a human hospital. That's one species. So when we're talking about it, I have this discussion a lot about different species, different production types. It really needs to be tailored for each situation. So it's a big job. It's not a little job. It is going to take us years to work through it and then continue to update it. And we really hope to work with efforts that are ongoing in other areas there. And the language says, in animal ag, really played a part in getting this in there, must include scientifically validated best practices. So scientifically validated, that's trying to just protect from craziness, such as vaccination, sanitation, and other management practices. They already talked about that, selection and use. And this language came from some consumer advocates, but I think most people would agree. Guidance on limiting the number of animals treated and minimizing the duration of treatment to be effective. That's called veterinary practice. And then the monitoring section, there's a lot of discussion there, but as it ends, there's actual language that requires us to work with USDA and FDA on national monitoring. Part of the thought process is there, especially USDA has good confidentiality built in there, and frankly, it would be nice to be moving forward with the whole country as we start to gather more data rather than it all just be coming from California. So we're hoping to do that. And it's not just sales and use data. It also specifically requires our department to look at ways to gather surveillance on antibiotic resistance, as well as different husbandry practices and how that all kind of feeds in together with the more longitudinal and deep studies, which USDA is talking about the same kind of studies. So, and then have that feed back into the stewardship is our thought. It also requires that all the participants are volunteer, so willing participants. When I talked to, I just talked to them at a hearing yesterday, the consumer advocacy groups, names not included here, they're very worried about that because they don't think that, if you get it's a valid concern. If you have volunteers, it's going to be skewed data. But we've had, because of the confidentiality and our track record working with the NOMS studies, I'm not really concerned that it's going to be skewed data because we can review it to make sure it's not. In fact, the legislation requires us to review it to make sure it's not skewed. And I think they're going to wait and see on that, and that they'll believe us until they're seeing that that's not happening. I mentioned the confidentiality already, and then we need to report back to our legislature by 2019 on the success of what we're doing. So just kind of what's happening now, we use a lot of, just like when we talk about the different antibiotic forums, the key that has been in California is having a lot of stakeholders in the room at the right time. And most of our stakeholders, again, were the different agencies, public agencies, so Public Health Department, Veterinary Medical Board, producer groups, veterinarians, veterinary business associations, our laboratory, which needs a new director, USDA and FDA, etc. So we're really trying to reach out right now. We have a couple meetings scheduled this this month, to kick off a couple of our efforts. And really it takes money. So that's the truth. That's the bottom line. The initial estimates to implement, if USDA was funded to do their action plan, which of course wasn't funded in this current budget, but there is money in next year's budget budget proposal, which will probably never go through for a year or so. Their estimates were about $4 million to implement this in California. There is currently in our governor's budget actually general fund, so they're putting their money where their mouth is. It's not a fee on industry to try and make this happen in this general fund. About $1.4 million to kind of get things started. And then hopefully we'll be able to look for some federal funds to help supplement from there, or go back to the legislature next year before 2018 to see if we can finish funding the program. So that's pretty much where we are right now. And I put this up here for those of you, I'm sure everybody's weighed in on the federal budget, but just so you know I'm sure everyone in this room knows where the AMR money is in USDA. It's in the zoonotic line item. The extra $10 million that they put in this year. And so my take-home message is exactly what you all probably would say. But this is what I tell our industry and our legislature and everybody back home when I'm talking to them, especially those not as familiar with, like I just talked to the California Cattlemen Board last week. And I still need to tell them I'm surprised that this is a real issue. I mean, antibiotic resistance is a real issue, and our veterinarians are seeing it when they're treating animals. So we can't just ignore it. And then the next thing I always say, because you guys know, to get cattlemen or other people to hear you, sheep owners, you need to acknowledge that where the real problem is for human health, the highest level problems are really, human use of antibiotics in hospitals and resistance there. I mean, that's the biggest threat to human health. And then the third breath is, just like you all know, but animal use does contribute to the overall resistance issue, and we need to do something. And the last bullet down there, I cannot tell you how much the work that this forum and then the different meetings that you've had and the white papers has helped us in this process. Because getting those white papers out, because you were ahead of the game, getting those white papers out to our legislator and people who had doubts was very, very helpful.